Dr. Pierluigi Delogu. Round one of applause, please.
Good morning. Thank
Good
you,
morning.
Stephen. Thank you. I read my lecture because I don't want to go out of my time. And then it's a great pleasure for me to be invited and as a reporter of the second edition of Industry, from the need to the solution. And I would like to thank the organizer, Stephen, and all the people who have wanted the presence of a representative of Italian worldwide and odontology, of Italian and worldwide odontology. I'm Pierluigi Delogu, as said Stephen. I came from Italy. I represent the Italian Dental Association. I was president of this, but now I'm a representative of the Italian Dental Association in the Council of European Dentistry. It's an organization of all the dental associations in Europe. I think that the organizers have done a good thing because they wanted the dental part in this event, which will be the point of reflection of these new additive technologies, for which our association has particular attention, as we believe that they will bring radical transformation in the dental sector of the coming year. We have been able to see in the last few years how this industrial technological process had a huge expansion and are even creating day by day terminologies to definition that fall into framing such techniques. For example, up to the few years ago, it was exclusively spoken of 3D printers, and now we see that there are a lot of terms to define and describe the various technologies that carry and produce 3D type, and then we see that we have in manufacturing or generative manufacturing, additive manufacturing, 3D printing, fast manufacturing, a lot of terms, and a lot of acronyms that you see, SLA, SLS, 3D printers, FDM, DLP, and other. As well, there are a lot of different materials that are still being studied and refined daily to produce 3D objects with different uses and applications. In short, the process of 3D is a process that makes working with the material to build object, as you see in the slide. And this project, in these technologies, is competing with the last one, technologies that they derive from virtual model CAD/CAM, who use subtractive construction with cube material feed. The most common used material in 3D printing are different types of polymers, metals, and some ceramics. Of course, it's also expected to evolve in the use of materials. For this reason, it's important that they be tested with great care for biomedical application. The potential benefit of these technologies are listed in this slide. And one of the most important things is that these technologies allow you to have absolutely individualized artifacts with a relatively simple procedure, and you can make and create very lightweight structure that, especially in medical and dental applications, can be very useful, as well as there will be less waste of energy, less CO2 production, can also provide a lot of opportunities in the production of certain types of therapies, making it possible to produce even across in the countries this therapy. Dental applications are many, and probably have not yet found them all for the reproduction of dental, tooth tissue, prosthetic, reconstruction, or even anatomic part, with defined precision, but up to now of 16 microns, but probably in an immediate future will come to precision that approach the size of the cells. And this will lead to improve and even more chances to lead dental therapies such as bone graft, gingival graft, post-traumatic or bone cancer post-reconstruction, dental reconstruction, even soft tissue reconstruction. In all this respect, the Italian Dental Association, which is a part of the European College of Dentists, wanted to organize, with the help and support of some European and Italian parliamentarians, as a meeting. Parliamentaries Mr. Tamburano, Mrs. Toia from Italy, a conference on the use of the revolution that the use of additive manufacturing can bring to the dental sector. This meeting was held on 30th of November 2016 and attended by me, Dr. Seeberger, that is here with me, Mr. Tamburano from the Parliament, and other parliamentarians, and with the coordination of Giorgio Magistrelli, that is present here with us. With the collaboration of several representatives of other European dental associations, such Portuguese Association, Netherlands Association, Norwegian, and Polish, to set up a discussion plane with a component of the European Council to bring forward proposals to uniformize, regulate this sector uniformly and apply this technology to dental care through Europe. The Italian Dental Association that I represent was founded in 1984 and is representative of dentists in Italy. Its work is devoted to improving the professional aspect of the organization, the safety of the operators and the patient, and to make important policies and proposals that can improve the condition of oral health of citizens. With this aim, I wanted to start a study path and then organic proposal to other European associations that will lead to a work group on the topic of 3D printers in dentistry. This group should outline a strategic plan to increase knowledge and technology development and their application in dentistry through knowledge, experimentation, and even subsequent regulation. In practice, AIO want, with other associations, produce an European project that will are identified with TRL. These are three letters. TRL project. These are three letters, each have a meaning that is the core of the European project that AIO is carrying on. T stands for training, R stands for research, L for law. We hope to apply synergistic action involving all European dental associations, but also dental industries and state or private university. T, training for dentists, especially on the new opportunities to work, on the new opportunity to apply new technologies to the dental field, both as regard the aspect of hardware upgrade, software update, upgrade of usable materials and their characteristics, their non-toxicity, on the personal skill, training on the personal skill that need to be put in place to use this technology, and then the field of application. R is research. Research that has to be driven by a triad that set limits and goals to a triad formed by profession, university, and industry in order to find out how to evaluate and standardize the biocompatibility of this material used with in vitro testing and in vivo experimentation, the properties of materials and durability they have and the resistance, how they are used in dental practice, such as barrier that they can create for the microorganism, and then all that can have an impact in both human health and environment, if it's a good things for economic point of view, and if can bring a benefit to the states, to the sanitary health organization. L is law. Law, as well as association and industries, we need to confront the political part with the ministries of various countries and with the European Council, as the development of the interdisciplinary areas for nanotechnologies requires a number of new reference, new standards, and hence the world study that has reference to standardization on the definition of materials that have already been set up in the last regulation on medical device, but need to be further integrated. Of course, this project, TRL project, aims to ensure that these definitions are not too complicated and do not lead to a major upsurge of bureaucratic fulfillment. With this project, through the discussion of the various nations and dental associations, as well as the other components, we could well define that what is the role of the various interpreter and user of this technology. Of course, the role of the dentist, we think that is central, as he is the medical actor who is the main actor in the use of these techniques and therapies on the patients. These are the objectives of the project. Improve dental care accessibility, improve procedures for this kind of technology in dentistry by coordinating research projects. Improve dental care accessibility by reducing the cost of procedure. Simplify all those who are in the process of authorizing new techniques and materials to avoid being bothered by bureaucracy and having a homogeneous approach towards manufacturing additive industries across Europe. So we definitely think it's a decrease in cost for useless and for the production of dental materials, with an advantage also for the environment and the end also for biological cost, with an advantage also for the health system in various nations. The cost, we think, that is really decrease. This is a slide that explains that the 3D printing market has grown enormously over the last few years and expected to reach about 21 billion in 2020. These are a distribution that we know about the application, and the dental sector is a market about 6 billion in the 2015. As you can see in this slide, the European Commission have launched a lot of program to stimulate investment and research in this area, and Horizon 2020 will be 60 projects financed by European Union. The European Union stimulates the research in various fields. We would like to be able to include an organic and lasting plan in time as European research design in the field, in dental field. These are some examples of European investment. I'm just finished. Bioscaffolds, Ceram Factory, Sibionka. Okay. The last things, this is the new regulation about the medical devices in Europe, approved in the 5th of April 2017, as amending the Directive 2001/83, Regulation 2002, Regulation 2009, 178-1223, and repealing Directive 9305 and 9342. It's an important change in this sector about this directive, and we wanted to drive this changing with the dental association, with the industry and the university, for made with the political part, for made a good future in this sector, but not complicated, but useful for all the stakeholders. Thank you very much.
Thank you. Don't go anywhere. Don't go anywhere. You stay here too,
Yeah.
because now we're going to bring up all four of our speakers.